If you're supporting an older loved one of the biggest questions is this: what type of care is actually right for them? The UK offers several different options, and each one is designed for a different set of needs. Many families don't realize how different they truly are, or which option will protect both safety and dignity. As a UK registered nurse and best interest assessor, I've guided many families through these decisions. Today, I'll explain the main types of elder care in the UK, simply, clearly, and with the practical focus you need. First, home care, sometimes called domiciliary care. Home care lets someone stay in the place they know best, their own home. It's ideal when daily routines are mostly intact, but small supports are needed. Medication prompts, help with washing and dressing, meal preparation, or companionship. Home care can range from one quick visit a day to several calls or even hourly visits. The big benefit? Familiar surroundings, preserved routine, and the comfort of home. The trade-off is that it relies on the environment being safe and the person being reasonably independent between visits. Next, live-in care. Live-in care means a trained carer lives in the home full-time. This works well when someone needs constant reassurance, has early to moderate dementia, or requires more personalized one-to-one support than visiting carers can offer. Live-in care can keep independence intact while offering companionship and safety around the clock. It is usually more expensive than hourly visits, but it's often less disruptive than moving into a care home. Supported living, sheltered housing, or extra care housing sits somewhere between independent living and a residential home. Here, your loved one has their own flat or small house, but there are on-site support staff, emergency alarms, communal spaces, and optional services like meals or social activities. This is perfect for older adults who value privacy and independence, but would benefit from a safety net and a little community nearby. Residential care homes provide 24/7 personal care and supervision. They are the right option when someone struggles with daily tasks, personal care, or if falls and near misses are becoming frequent. Residential homes focus on personal care, meals, social activities, and keeping people safe. They do not provide the same level of clinical nursing care as a nursing home. Their strength is steady supervision and day-to-day support. Nursing homes are for people with complex clinical needs. If your loved one requires regular medical monitoring, complex wound care, or has advanced dementia with unpredictable risks, a nursing home offers registered nurses on-site 24/7. Nursing homes handle higher dependency care and rapid changes in health status that would be difficult to manage at home or in a residential setting. It's also important to mention respite care. Respite provides short-term stays in a care home or scheduled care visits at home, giving family carers a much-needed break. It can be planned after surgery or illness, or booked regularly to help prevent burnout in the family. And finally, NHS Continuing Healthcare, or CHC. This is a lesser-known but crucial route. If someone's primary need is health care rather than social care, the NHS may fund all their care, whether at home or in a care home. CHC is not about savings. It's a clinical assessment based on health needs. Severe dementia, complex nursing needs, or unpredictable high-risk conditions can qualify. If you suspect CHC might apply, ask your GP, district nurse, or social worker for a CHC screening checklist. So, how do you choose between these options? Start with safety and dignity. Ask, can they be safe at home for the next 24 hours? Are their needs stable or worsening? Is the family coping practically and emotionally? Does the current setup promote quality of life, social contact, meaningful routine, dignity? If the answer is yes to safety and independence with manageable needs, home care or supported living may be best. If you need constant one-on-one support without a move, live-in care can be the right bridge. If personal care needs are increasing and supervision is required day and night, residential care is a sensible and supportive environment. If clinical needs are complex and unpredictable, a nursing home with 24/7 nursing is usually the safer option. And always check for CHC if the care demands are primarily medical. Remember, there's rarely a single perfect choice. The right decision is the one that balances safety, well-being, and sustainability for the family. It's about matching the level of care to the person's needs, not fitting the person to a label. A couple of practical tips. Get a full needs assessment from your local council. It's the gateway to finding out what support is available and whether there's financial help. Keep a clear log of incidents, falls, or missed medications. This record is invaluable when professionals assess needs. And involve your loved one in the discussion as much as possible. Their preferences matter and often guide the best long-term outcome. If you're feeling overwhelmed, that's normal. You're dealing with both practical choices and emotional decisions. Take it step by step. Start with safety checks, arrange a professional assessment, and explore trial visits or short stays when possible, because many families find a short respite stay or a trial day at a local service brings clarity. If this guide helped you make sense of the options, I'd love to support you further. Subscribe to ElderCare Compass for more calm, practical videos grounded in real clinical experience. I'm a UK registered nurse and best interest assessor. I'll continue to share clear, trustworthy guidance to help you make confident decisions for the people you love. This video provides general information and is not medical or legal advice. Always consult qualified professionals for personalized guidance.